Okay, so I'm going to talk to you a little bit about a balance progression. So I get a lot of my cyclists that, as we get older, our balance gets worse. And the theory behind that is vision gets worse, the inner ear vestibular system gets worse, and then it puts more and more stress onto the foot and ankle. So we can basically take two of those systems and manipulate them a little bit, that vision system and that vestibular system. So the really easy and standard balance exercise is just hands on your hips, leg up. The hands on your hips piece basically takes away the upper extremity from doing more of that balance. So if you think about a tightrope walker, they use the giant stick. That bit of inertia to move that stick makes them have an easier time to balance. So take that away, put your hands on your hips, bring that knee up further and further. That'll make it harder because now that standing leg is working harder to keep this hip in extension as that other leg is coming up and trying to basically rotate your pelvis. So this is a really good way to challenge that single leg balance. And then again, we can take the different systems into account. So you'll basically stand on one foot, taking the vestibular system down, making that have less input and making it harder to balance. You'll turn your head left and right. That makes our foot have to do a lot more work. That's number one. The vision system, taking that piece away, is the eyes closed aspect. So I'll switch legs, stand on one foot, close your eyes. That's making your foot work a lot harder. My balance is a little bit off today. Did my workout earlier, so legs are tired. But again, eyes closed. This is a good way to test side to side and really get an idea of how good your balance is in those different scenarios. So the eyes closed piece seems drastic, but we're considering low light environments. If you were to get up in the middle of the night and the lights are off, you want to feel like your balance is challenged in that similar way, especially if you've already been up and moving around like I am now. My legs are more fresh. I should be pretty good at holding that balance. Eyes closed for at least a little bit of time. And, we're basically then saying when you get up in the middle of the night, your legs are not as fresh. You want to make sure that you've basically increased your capacity to do something like walk to the bathroom and not fall over. So taking these into account and trying this, gauging where you're at. If those are too hard, I basically just take the balance down. We might do it in tandem. We might do it in semi-tandem, and then do the same things. Head turns. We might go eyes closed tandem, hands on your hips, and then we're basically doing the same thing, making those feet work, ankles work harder by taking the systems away, and then we can again keep progressing up to one leg as you get better and better with this. So I get asked a lot on balance, so that was just my quick progression and what I consider and how we can make it more than just being here. Of course, the other really nice pieces would maybe do something with your hands. So I tell people stand on one foot or stand in that tandem stance, brush your teeth, cook, do something else to take your mind away from it. So then again, we might have the inner ear and vision systems there, but now that cognitive piece is a really good one to also challenge, or that motor control piece of using your arms and doing something else. So those are all the aspects that I would like for a lot of my patients in the physical therapy clinic, or cyclists that are having a hard time with balance, to consider and to try. So it goes a long way, keeps you healthy long term, reduce risk of falls as you get older in life, and overall increase longevity and happiness. So give that a shot. Let me know if you have any questions.